very excited to have with us our next guest, again, someone who is playing a critical role on the front lines of healthcare delivery and in areas of the world that we usually have very little exposure to in North America and in Europe. So just excited to have Dr. Mohammad Baby with us today. Doctor, how are you?
I'm fine. Good afternoon, Stan. Good afternoon, everybody. I'm very glad, excited to be part of you today. My greeting from Africa, especially today. I'm based in Mogadishu, Somalia.
Incredible. And such a resource constrained and such a critical area with so many folks suffering. Tell us a little bit about your background and what you do there. Okay.
Thank you so much, Stan. I'm a medical doctor. I'm in charge of United Nations, some field hospitals in Somalia, as well in Sudan and South Sudan also. So I'm working remotely, like I'm working on the field as well. And my main work is to support the African Union troops, military hospitals in the field, to provide health care, health education, supply chain, pharmaceutical management in the field, as well as medical evacuation casualty management from the field to the higher level hospital and level care, either in Kenya, Nairobi, or South Africa, to provide good health care. I also provide the training in combat tactile medical care during the war, so as a capacity building for the soldiers deployed in the field, as well as medical investigation, screening, pre-deployment medical tests before the soldier arrive in the field. Thank you.
Incredible. And Dr. Baby, if you could turn on your video right now. We're not seeing video. I don't know if you have video. If you don't, that's fine. In the meantime, if you could also, the audience that's listening to this is just stunned. Obviously, it's amazing what you're doing in Mogadishu, in Somalia, and trying to provide the fundamental healthcare that everyone needs there. Tell us a little bit about the digital infrastructure that you're seeing and how digital technologies, whether it's even digital offerings through smartphones or even just using smartphones for voice communication, telemedicine, whatever you can do, and supply chain, either supply chain management or any kind of patient triage or syndromic surveillance, any of those activities that we see oftentimes in ecosystems in need in healthcare. How are you seeing digital provide assistance to, again, either medicine delivery or healthcare delivery?
Thank you, Stan. Digital health we are using, is like 6 months ago, we established a pilot project of telemedicine in Somalia, which is working perfectly. We are communicating with our hospital, all from the various sectors and the region. We get the information of the patient from the field. This helps us to make a correct diagnosis and make a decision on time, either to evacuate or to send to Mogadishu if after stabilization. This digital health telemedicine development also help us to provide health care education, promotion, and it can help a lot to prevent any outbreak. Recently, last week, we have a outbreak of cholera in one of our regions, affecting a civilian population, which are very, very close to our troops. So the digital health for the doctors in this area are using the mobile phone. This mobile phone provide all the information of this outbreak, and it helps us to communicate with WHO, provide the number of people affected, prepare the kits and drugs to be deployed on time by helicopters, and also to make a contingency plan by quarantine the patients who are already affected aside, not to contaminate all the troops. It's very, very important for us, this digital health. And also, this digital health or for digital medication also has with those not all the area, but most of the area, the tools like a reminder. For example, you provide this vaccination, we can track the first dose which has been administered this date. What is the reminder of the second dose? It helps us a lot to do that. In this kind of situation, recently, as I said, the outbreak of this cholera, the health information is critical and very important, and it can prevent a lot and help our troops also. The data collection from the tools also is very important, no, and it helps us to make a correct diagnosis, the treatment of the patients, and even if it's the civilian population who are living just across a road, they don't have enough resource or money to get medical care, we can ask the WHO or some international NGO to provide help. It's very important for us. And also to manage the health program. The health program in the post-conflict countries or the conflict country where I'm based actually also, this health program management system help us a lot to do the consultation, screening, and facilitate the access. Saying that, in this war zone, either in Somalia, Sudan, the mental health is very, very important. The digital health help us to monitor the people with post-traumatized diseases, mental health, and also to help in case they need any evacuations on humanitarian ground. Thank you, Stan. Over to you, please.
That's incredible. I mean, that's a textbook almost right there, just to help our attendees listening to the program today understand exactly what is going on in such a conflicted country and with so many patients. And if you're listening to the program and you haven't caught up on what's happening in Somalia, I would recommend just typing in Somalia in Google and then clicking on the news icon at the top and catching up on what is happening in Somalia, just to bring about a greater degree of understanding and empathy for what Dr. Baby is doing and how they're utilizing digital across so many different parts of the healthcare continuum, the value chain, if you will, from medication and supplies delivery through the various components of medication and supplies implementation, actually administering vaccinations and antibiotics, et cetera. So critical, so fundamental. We take it for granted in so many of the places that we live today because we're so lucky. But we have to remember that the human condition is not the same in the wealthiest 1 billion homes as it is in the lowest income 1 billion of homes. And again, the term of art that Dr. Baby's using, the most conflicted 1 billion homes. And we see a lot of that these days, and it's getting worse, unfortunately. And so we do have really an opportunity, but more importantly, an obligation as some of the lucky people on this planet to do good work and to help out. Dr. Baby, from your perspective, and I know we're winding up your time here today. I would love to talk to you for hours, frankly, but this is something coming from one of the questions I'm getting on LinkedIn from the audience, which is, how can we help you? What can we do to help you and help your teams in Somalia and in other conflicted nations around the world that the UN is striving to assist? What can we do to help you all?
Okay, thank you so much, Stan. And any help will be very helpful, and it will be very fruitful. First for all, to facilitate the access to the health. That is the main challenge we have. If you have access to the most of the population to have this access, it will be very helpful and minimize the cost. So if we facilitate the access to the health, first for all, we'll start by facilitate the health information, education, sensitization. All those are important. But when we receive a support, to facilitate the health care. It started like a mobile clinic. A mobile clinic, for example, will help to facilitate the health access. Mobile clinic, why? The war can move from one area to another area. So we are based now in point E. So tomorrow point E can be attacked. It can be attacked by Al-Shabaab, Islamists, or, then not only it can be attacked like this outbreak of cholera. We have to move from one place to another place. That is the mobile clinic. If we have the access to our to have a facility of healthcare, that will be very, very grateful and help and minimize and save a lot of lives in Africa, especially the zone which are affected by the war. And to tell you, we have more and more regions being affected. If you take from before COVID pandemic to now, it increased from 8 to 15 regions now. So I have to deploy medical staff in each areas. Of course, we are collaborating with Médecins Sans Frontières, some humanitarian NGO, or a lot, but not all of that. For security threats, they will not stay, they will go. So we have to reinforce our capacity by providing good health training, health information, promotion, and education. And any help providing will be very, very, very efficient and helpful for our communities. Most of those communities in Africa, they don't have access to healthcare. The insurance policy is not well established. So, and also how to reach, if you have to do the distribution of supply chain. I'm very happy you emphasize the supply chain. So we are, there is a project, there is a plan. They want to use the drone for distribution, because sometimes you want to send even the food supply with the medicine to some area. So, but the road is not secure. So this reduces the distribution of supplies to those regions. It's delay, but the delay will come with consequences. So that I can throw here. Thank you, Stan.